Hi everyone, I hope you can all see and hear me okay. I'm really pleased to be here to welcome you all to the Hepatitis Scotland online conference, Living Experience, Patient and Peer Perspective. So my name's Norma Westland and I'm the new Programme Manager at Hepatitis Scotland, and today is the first of two half-day conference sessions we're having where we're looking at Hepatitis C experiences with new treatment. So the conference is going to be broken down into two sessions that showcase two surveys and highlight the volunteer experience and stories. The conference has been made possible by the volunteer peer researchers with Hepatitis Scotland who've undertaken two pieces of peer research for us. So I'm just going to quickly bring up the agenda for today. So we're going to look at a survey undertaken by those who've completed the new antiviral hepatitis C treatment. We'll have a presentation of the survey, a discussion with some professionals who support people through treatment, and then we'll have a live question and answer session with those staff. We'll then have a short break. After that, we'll show you a couple of animated videos that were made by Hepatitis Scotland for World Hepatitis Day 2020. These include some real interviews where people describe their experiences of the new Hep C treatment. Finally, we'll watch a video about change in action, and this shows two interviews with people who've not only gone through hepatitis treatment, but they're going to discuss their past drug use, their support, their recovery, and their transition into employment and education. And that will be followed by a live question and answer session with the two people that are in the video. Yeah, so we're now going to see a hepatitis C treatment survey presentation.
Hi, my name is Billy Hamilton, and I'm presenting the HCV completed treatment study. This was done with peer research volunteers doing a scoping exercise regarding people who have completed Hep C treatment. Originally, we intended to do this nationally, but with the effects of COVID, we sort of concentrated in where we could. So it's mainly rural areas. There's 48 participants, 33 males, 15 females, but the health board was mainly Ishanarn and Lanarkshire, with 5 in Greater Glasgow and Clyde. As you can see, 1 each from Lothian and Tayside, Forth Valley. So we asked when people finished their treatment. As you can see, 28 of them were in the last 12 months, and what's that, 28, 37 in the last 2 years. So I see that as a really good sign that people are coming forward more for treatment than was previously the case. So there was only 10 that was more than 2 years. So we asked if people had previously had hepatitis treatment, and 10 had said they had. 6 participants was more than 5 years ago, and 3 within the last 5 years, and 1 that didn't provide information. There was a fault in collecting the data. So this was in regards to, was using the old treatment, interferon and ribavirin, was that a barrier to the new treatment? And basically all the people who had previous experience of the old treatment stated that this had actually influenced their decision to go forward for the new treatment. I mean, it's hardly surprising, but we asked what ways did it influence you. The old treatment put me off terrible experience, found out of others about the new treatment. It did put me off, to be honest. I was a bit anxious, terrible side effects. I ducked the new treatment because the old one was terrible. We asked people since they finished treatment if their drug and alcohol use had actually increased or decreased, had any kind of influence on their lifestyles, and I was quite surprised, but quite happy to see this. 30 participants had stated that their drug use had actually decreased, and 16 had said it stayed the same, and a few of them were actually abstinent anyway, but only 2 people out of 48 had stated that their substance use had increased since they finished their Hep C treatment. And actually 2 of them reported it was other things like family bereavement and issues that kind of led to that increase. So it's quite startling, really. if only 2 out of 48 saying their drug and alcohol use had not. But that's what we got. So also asked if it enabled people to improve their personal well-being or their community involvement. And again, really, really positive results. 42 people had said that being clear of Hep C had enabled them to improve their personal well-being or being involved in the community more. Obviously, this is predominantly before COVID that we're talking about. 6 participants said it had not, but out of them, a few of them had said that actually they were quite active in the community anyway, and they didn't feel anything with their Hep C. And a couple of people said they had long-term health conditions that they were stuck in the house anyway. So it was really, really positive and stuff in regards to personal well-being. So again, we asked what people had done. So a lot of people were engaged in recovery-based support and physical activity, sports, increased volunteering activities, including ourselves. Improved relationships was a big one for a lot of people, the confidence to get into relationships with people now. And there's a good few people now in employment and education, again, include people that's volunteered with us. We asked about people's general health. Again, I found this really positive that only one person had thought their general health had got worse. I just feel as you get older, it gets worse anyway. But 36 had said it was the general health was really better. 11, no much change, and only one person said it got worse. So again, some of the comment, a lot is a bit more energy. People feeling a lot more energy about themselves, not as tired, mind is clearer, eating healthier, and getting their appetite back and stuff like that. So I generally feeling better. Again, what things have you noticed most? And it's a lot. Energy seems to be the big thing. You know, less lethargic, physically fitter, clearer mind as well, more motivated. Again, eating more healthy, better self-care, more involved in the community, as we said before, new social circles, and the obvious less pain in the liver. So how long ago did you have your first positive Hep C test that you knew about? I mean, you could look at this in a lot of ways, but there's 28 people out the 48 have had Hep C more than 10 years, 11 more than 20 years. So again, you could look at the treatment was a barrier before, but the new treatments have been about for 5 years or so. So there obviously is other barriers or issues for people to go forward for treatment, as you can see with the numbers. So how quickly after being tested were you offered the new treatment? Again, this is really positive. I mean, it's maybe 3 years since I've worked in the kind of front line, but these results are quite remarkable, really. You know, that's 17 immediately, 16 within a few months. I mean, that's really, really quick for Hep C treatment. And especially as if we're going back, you know, 3 or 4 years, it's really encouraging that people are getting treated so relatively quickly. And thinking about the last time you got tested, how easy was it to access testing? Again, really positive responses. 38 people, someone offered it to me at a convenient time and place, and 8 people said they had to ask for it. One person, it was hard to find out where I got tested. Again, I'm going back to when I worked in the front line. I find these results pretty remarkable, and I hope that represents that things have changed, and it seems to have done that. It's a lot easier to get tested now. And the main reason that helped you decide to access treatment when you did, again, this is showing you the importance of professional workers and include peer recovery workers in that. We never separated the individual workers in the survey, and we probably should have. I know a GP was only one, and the main source was BBV nurse and peer recovery workers and addiction support workers. Again, it shows you the importance of professionals and having a relationship with people and guiding them into treatment. But you had 18 people with multiple answers. So you had 18 people that thought they decided themselves or help for their family, and 11 who knew about the new treatment as well, and that was a big kind of factor. So we asked again, what was the main motivation, personal reason for starting treatment? And again, there's multiple answers here, but the main ones, as you would expect, are to be free of Hep C and to improve your health and to improve your life. There's also stigma there with 4. The new treatment options again were 8. And another big one is peer support, 13, which is the third most important motivation for starting treatment. So again, shows you the value of peer support as well. How easy was the treatment? I mean, I can say I've never met anybody that said it was the new treatment was difficult, and I mean that, not one person. And here we go. Easier than I thought. 8, not too many issues, because we asked people if there was any issues, and some people would say they were a wee bit tired or lethargic at first, or it made them sleepy. Some people said they couldn't get to sleep, but mostly those symptoms went away pretty quickly. 2 people said it was harder than they thought, and because I've got a background in this, because I was involved in every question with the peer researchers, these 2 people had other things going on at the time, and I think it'd be fair to say it really wasn't related to the treatment. For example, one person was sectioned under the Mental Health Act at the same time he was going through treatment. So I would say it's pretty convincing that the treatment's really easy. Is there anything you think you would have made starting treatment easier? I think this is where it can be slightly skewed, because 28 people from the 48 actually got support through treatment. So that did surprise me at the start, but then when I looked at how many people actually got support, it's not. 39 people said it was really easy to get through treatment, but when 28 of them are getting taken to hospital, well, that's maybe not surprising. 7 people said yes, and their suggestions were financial support to travel appointments, more information about the treatment, provide transport to hospitals, I think a big one in rural areas, better communication about what was available, and provide more support where it was needed. Do you think you were given enough information about the new treatments? Again, very, very positive. Only 2 people said no, they didn't think they got enough information. Out of 48 people, 34 said yes, and 12 says it was okay, but they could have done a bit more. Again, really, really positive. Who gave you the information? Again, BBV nurses were the highest, if I remember correctly. GP peer workers were pretty high, and addiction support workers, and also friends and family and people who'd peers who had been through treatment also passing on positive information. So we asked people, how did you feel when you get told you were Hep C free? And you can see some of the comments there. Over the moon, a lot cleaner. That was a lot of people said that they felt cleaner. You know, a cloud has been lifted, fitter. Again, felt clean, amazing. Delighted, totally brilliant. I got offered a job where I used to be a client. It's brilliant. And my favourite one, amazing. It's as if I just threw away an old stinky jacket. So, aye, it was all positive stuff. I think this is really important. We did not ask in the survey if people felt they would have completed their treatment without support, but 16 people actually stated it without being asked, that they believed that they wouldn't have completed their support if they hadn't, their treatment if they hadn't had the support. So some of the comments there, I had all the workers, I had all the support, but I may have struggled without them. Peer support workers, got peer support to make to the hospital and then started the support group. Got support from peers, don't think I would have done it. Support was there. If it wasn't, I wouldn't have managed it. I got a lift up and back and text me appointments. I don't think I would have completed it. And I got support from a worker. I have anxiety, so no, I don't think I would have managed it. 5 participants were also in prison and reported that was a positive aspect of accessing treatment. Again, I was in prison, so it was easy. In jail, everyone's there for you. 1 person was also in rehab, and they said they did not think they would have completed the treatment whilst not in rehab. I'd just like to say, I think there's some fantastic information from this survey regarding the improved testing. The treatment now seems so easy and accessible compared to what it was. Also, the importance of professional workers and BBV nurses, addiction staff, encouraging people to go forward for treatment. But there's also many issues here, or many positive impacts in other areas of people's lives that perhaps we didn't really expect, in people's general health and their mental health, their personal well-being, community involvement, volunteering, employment, education opportunities have come up, relationships. And the fact that 16 people have stated they would not have completed their treatment without support, I think shows you the value of BBV support, especially in rural areas. And I'd just like to thank everybody involved, and that's the patients, participants, the staff that referred people on, and most importantly, the peer researchers who conducted it. Thanks very much.
Thank you for that. I should have said before the presentation, that was Billy Hamilton. Billy's our Community Development and Involvement Officer with Hepatitis Scotland. And Billy's going to be joining us later on in the live question and answer session. And Billy will be summarising some of the questions that hopefully you've submitted for the panel. So following on from Billy's presentation there, we're going to have a discussion around the main findings of the report. So Billy had hosted this discussion and he was joined by Lindsay Stronach and Thomas McClung from Terence Higgins Trust, Eddie Wilkie from Positive Futures, We Are With You, and John Aitken and Hugh Reid from North Ayrshire Alcohol and Drug Recovery Service, who were formerly bloodborne virus support workers in Ayrshire and Arran.
Hi, my name is Billy Hamilton. I work for Hepatitis Scotland. We're going to talk about the previous completed treatment survey, and we've got a range of guests here who can introduce themselves.
Hi, my name is Lindsay Stronach. I work for Terence Higgins Trust. I'm the BBV support worker for Ayrshire and Arran.
Hi, my name is Hugh Reid. I'm a recovery development worker with Addiction Services and formerly a BBV worker in North Ayrshire.
Hello, my name is John Aitken. I'm a recovery development worker for North Ayrshire Council, and I was formerly a BBV worker with the local ADP here in North Ayrshire.
Hi, my name is Eddie Wilkie and I work for Positive Support as an assertive outreach worker in North Lanarkshire.
Hi, I'm Thomas McClung. I'm THT, bloodborne virus support worker in the East.
Right, thanks, guys. So the vast majority in this survey was for Ayrshire and Arran and Lanarkshire. So that's why we've got yourselves. So I think we've got it covered. The first thing I'm just going to ask, there's 48 people in the survey and there's 33 males and 15 females. Just wonder if you think that's quite representative, and I'll maybe start with you, Lindsay. Do you think females have got any other additional barriers to treatment?
I think there is an inequality with women, and there's still a lot of stigma. There is gender inequality. Sorry. We've started a women's group in North Ayrshire, and through working with that, we can have up to 16 women attending every week, which has been good for us in order to get testing, normalise the testing, and show that there is support into treatment and things. We've also linked with the BBV, the hospital team, the sexual health unit at the Gatehouse in Irvine, to run clinics side by side. So, for example, we would go and support a client, pick them up, take them for sexual health tests, smear tests, contraception, things like that, and then straight from there they'll go in and see the BBV nurse and start their hepatitis treatment and support for things like that. So I think if we're offering the services and showing that we're offering it, then that might bridge the gap with some of that inequality with the numbers that you've got.
Shog, you got any add to that?
I think Lindsay had it covered. I think there is more stigma surrounding females. and maybe a bit of lack of education when it comes to transmission and things like that. A lot of myths that it's a sexually transmitted disease. It shouldn't be any difference, but women with partners and things and children, maybe a bit more hesitant to come forward.
Maybe yourself, John.
So did you say the survey was a quarter of women? Quarter, was it?
To be honest, I thought it was pretty fair. 33 males, 15 females in my experience.
Well, for the people we were working with, I'm surprised at that. So that's a third of people, females. So it started with very, it was hard to get to engage with women. You remember the one that said she thought she was going to lose her hair? Yeah. You know what I mean? So I'm quite surprised at that. So it's good that obviously Lindsay's get a lot of people through with the women's group, which is specifically women, and it's hard to reach because of the barriers that you just talked about with women, and whether they've got school children or any other kind of barriers, sexual health and stuff like that, and stigma. So I think that's really a good percentage, because it's not my experience to start with. It was mainly, I'd say, 1/5 female coming into your service.
How do you find it up in Lanarkshire, Eddie? Proportion, is it mainly males or?
It's mainly males. We've got up in Lanarkshire, but I think it's been well covered. I think a big barrier is school children and stigma and a wee bit of guilt and shame with women, and try to access the right support for women on women, so they feel more comfortable about talking about their issues.
Thomas, you've got the hard one because you're on last, so then you could add to that.
Most things have been covered, Willie. I find both equal. I find the both of them, male and female, face all the same barriers. It's for me, once I've got trust with them, they seem to work right through it just as equal as each another.
I think John probably made a good point that the work Lindsay's been doing and Carol Ann and creating the group, and because that was something that we thought about years ago, was creating a women's group as well. It's probably, well, not probably, it probably has made a difference, I think. But Thomas, I think you're right. I think it's once you get people, everybody's got the same barriers, but probably initially women coming through maybe. Second thing was just how easy treatment was. I mean, there was 46 people, only 2 people thought it was harder than what they thought. And is that everybody's experience now, that the treatment is easy?
It's me, Billy. I've never met one person for all the treatment. They've got their preconceived ideas of how hard it was going to be because talking to people in the street with all treatments. But I've never came up against them that said it was hard. We had one person that says that it was a bit sleepy. But I've not heard them saying that the treatments were bad, really. But I've actually had somebody saying that they think they've been given the wrong drugs because they didn't get any side effect off them.
Yeah. The other thing I was looking at, 37 people out of the 48 completed this survey in the last 2 years, which I think is a really positive thing. Obviously, COVID's come into place here, but before COVID, do you think there were more people coming forward for treatment, and maybe information was filtering down that treatment was easier and more accessible? We'll start with you, Thomas, this time, since
I'm not finding that problem, Billy. We have to go and find all our participants ourselves, so we're still tracking them down and still getting them into treatment. We are not struggling with that. I don't know how the services are doing, but we manage, so we're still getting the same numbers through.
Good.
We're just not being able to do the testing.
Eddie, so my point was basically in the last couple of years, we were doing this survey last year, halfway through COVID, so a lot of it would be pre-COVID. And I'm just thinking a lot of people have done this in the last couple of years. So I think more people are coming forward and know more about treatment.
Definitely. I think they're getting more information. Once you kind of break it down and speak to somebody about it and reassure them the benefits and how easy the treatment is, they're 99% willing to go ahead with it. And on the flip side of that, if they've got support to get them to the appointments, that's a winner.
I think as well the events, the different events that we were holding, where we could be bringing people in for the testing, the BBV nurses were there. There was the initiative as well to give them something for coming and getting the testing. I think these were all really good at raising awareness, and it was getting a chance as well to talk about the treatments, those kind of things. I think they all obviously helped.
Another thing was, I was looking at it, those who'd experienced the old treatment, every one of them were still quite sceptical or misinformed about the new treatment. I'll go to you, John. Do you think that's still a case with some people?
Some people, as we said, we're out on the streets and we've been telling people in that cohort of people with HCV, they all kind of talk and they all kind of say about treatments, and they tell people they went through treatments and they've cleared that up. So I don't think they've got the same, there's not the same scare stories running about HCV treatment, but there is still a wee bit of misinformation. But once they get the correct information at the right time, there's no many people get that many barriers to going on the treatment once they start through the process.
I was looking at, there was 28 people that are over 10-year diagnosed and 11 people more than 20-year. 39 people out of 48 had it over 10 year. So there's obviously other barriers to treatment than just the old treatment. What would you think about that? Because obviously that's a long time with Hep C. And I know treatment itself was a barrier because it wasn't very good up until 5 years ago, but any other stuff that you could think about?
Well, I think a lot of it was ignorance, and because there's no a lot of side effects coming off of Hep C, when people are caught up in addiction and they're still using substances, that's the furthest thing for your mind is going to get treatment for it, because you'll know that it's a bit of a silent killer, because you don't feel any different. I am brand new, I'm all right, I've got Hep C, but I've had it for 10 years, so it's not a big deal. I've lived with this for, and they don't realise the damage their liver's getting. I think that was a big part of it, and that's why a lot of people never came forward, you know.
And the testing in this survey was extremely positive that I was surprised about. I mean, nearly everybody said that only one person says that they found it difficult to get testing. Do you think it's easier to get tested now, Eddie?
Aye, there's that many services offering testing now, and there's that many services support people to get tested. There's a lot of information out there. If you're willing to look for it and you want help for it, you'll find it.
And I know what it also says is treatment has been offered quickly to them. The majority is under 2 months. Do you experience that, Thomas, that people get treatment pretty quickly? I know it's difficult with COVID right now, but
if they come through us, they'll get treatment, but if they go through the services in my area, they will not get treatment that fast.
aye.
Oh.
So yourself, Lindsay, do you think if it goes through yourself, you'll get people treatment?
Yeah, I think as well the BBV unit had changed how they were offering the treatment, because when I first started, we were transporting people up for 4 appointments before they were even initiated for the treatment to start. They had to see a consultant, they had to see the pharmacist, they had to see the nurse twice, and then I can't remember, was it 8 weeks at first for the prescription to go through to the pharmacy and things like that, whereas now you can certainly see the nurse. If everything comes through okay with the blood tests, then we're getting people straight through within, was it 4 weeks, Thomas? Now we can kind of see treatment beginning.
Yeah, that's for fastest yet. For blood test to treatment within 4 weeks, but an average of 6 to 8 weeks it takes us.
Mm-hmm. So that's really good compared to Lindsay said. I remembered a few years ago. Take months. Looking at a lot of positives coming out of this survey, and I'll be honest, it quite surprised me. But 30 participants had stated that their substance use has decreased since treatment. 16 is the same, and that includes people who were abstinent beforehand. And only 2 people have stated that their substance use has increased since they've completed treatment. How does that sit with you? Do you see that, or do you?
That doesn't surprise me. One of the when we started doing this a good few years ago now, we didn't realise that people's well-being would increase, you know, their physical well-being would increase, and the fact that they're achieving something where people really know. I mean, injecting drug users, they weren't achieving much. So we encourage them, this is one thing you can do quite easily. And that was, especially when we had support groups and drop-in centres, and we started one-to-one and getting them to engage with the services. So we seen them talking to us as a stepping stone to get into, as Eddie said, recovery activities, coming to cafes, going to wee groups, and people started to benefit for that. So they numbers don't surprise me at all, because I've seen that many people, their first step in recovery was addressing their BBV, and they've actually stayed in recovery.
I was trying to work out here. Do you think there's a feeling that treatment can be a factor in people's recovery, or recovery is a factor in people's access to treatment? I think it's a bit of both. That maybe people are at a certain age and they go like, you know what, I'm going to address this, and then it leads on to recovery, or I'm addressing my recovery and it leads on to treatment. Do you think people are just at an age that maybe they combine?
No, Bolly, I don't combine them at all. Recovery and treatment is two different things for me. I just focus on treatment. I don't care where they're at and their addictions or recovery. My task is to get them into treatment no matter where they're at. So I don't talk to them about their recovery or their drug use. So I don't know what to say things, Bolly. So I can't answer that.
Right.
So two of them said that the drug use has been up, and that's about 90% has improved. No, it doesn't really surprise me. And Thomas is right. It doesn't. The two shouldn't be combined, but sometimes they are, just because of the place people's at. If they're in recovery and facing up to other issues, that's when they're more likely to be willing to access treatment and face up to that as well. No, it doesn't surprise me that only 2%. When we were working with people, you know, we had like a set amount of time with them, whether when they were tested or simply was positive and needed supported treatment. So we would be signposting them, spending time with them and things like that. And most people that we supported did engage with some other form of recovery activity.
Do you see that as well, Lindsay, with the people that you're working with, that on the whole they...
Well, again, I would probably have to go back to when I first started and the criteria that people had to meet before they were offered the treatment, and how that's changed, so that it doesn't become a barrier, I guess, for people accessing the treatment. So now there isn't a barrier. It doesn't matter, I guess, where people are in their journey, that they'll still be able to get their treatment, and that they've every right to access treatment regardless of where they are on their addiction journey.
Aye. And the other thing I was looking at, we asked about health and well-being. So 42 people have said that since they were being cleared of Hep C, it's enabled them to improve their personal well-being or community involvement. Obviously, again, COVID's come into that about community involvement. So only 6 people had said that things hadn't improved for them in regards to their personal feeling and well-being and community involvement. Again, does that surprise MD, or is that what you would expect? And do you think it's connected with the treatment, or just where they are in their life? John, what do you think?
Aye, Billy, I think it's definitely connected to the treatment, because we found out that when people started going through the treatment, within 4 or 5 weeks, their skin started to get better. You know, their liver started to work better. You know, they had more energy. So it doesn't surprise me that their whole well-being, you know, they start talking. The majority of people start talking about getting out more, gone for a wee bike run, you know, a bike run round to the shops, instead of being isolated as much, they're starting to get out. So we've seen that. We didn't know that when we started, that people's well-being would increase, you know, their physical and their mental and even their spiritual health would all increase. So that is not one, but we didn't know that when we started. But now we sell it, that you will get better, your skin will get better, your eyes will get a bit brighter. So, and that's the hook you use to encourage people to get into other stuff. So that doesn't surprise me one bit, because I've seen that firsthand.
The energy thing seems to work. I think another important influence, and when it was asked about who influenced you, professional workers are a big, and a good peer workers are a massive influence. It was peer recovery workers, BBV nurses, addiction workers. I remember only one said a GP. They decided for themselves new treatment information, but the peer recovery workers, BBV nurses and support workers were the biggest influence on people actually making that step. The other thing is, what I'd like to highlight in this is, I mean, when I've not been in an office for a year, so I'm sitting in a room. So I'm relying on people like yous to make referrals to me for this. So it does slant the survey a wee bit, I think, because yous are people who support people. And I think there was 28 people out of 48 did receive support, but there was 39 people saying that it couldn't have been any easier to get treatment. Whereas my experience a few years ago was completely different. So it is a massive move forward. But I think it's important to highlight how important support is for some people. The 16 people, and this wasn't a question on the survey, 16 people, it should have been a question, stated that they would not have completed this treatment if it wasn't for the support that people like yourself have gave. Does that surprise anybody, Thomas? Does that surprise you in any way?
What I'm finding is most of the folk I'm getting in for treatment, I already know they've got hepatitis. The services are already aware they have hepatitis, and the support isn't there for them in the services. We provide it all, so we'll support them for testing right through it all, whereas that is lacking for them in this area. So they're not getting treatment.
Aye.
Though everybody's aware they've got hepatitis.
Yeah. Eddie, how do you feel about that out in Lanarkshire? I mean, it's basically just stating how important yous people are in regards to getting people through treatment.
I think it's vital. It's vital for them to get the support because Lanarkshire's a big area and there's a lot of isolated wee communities out with. And I know through working with people that's caught up in active addiction, they've got a tenner for their bus fare and they need to go and get a fix for that day or a bottle of wine or whatever it is they're into, they're going to go and get that bottle of wine. So that's where our interventions come in and we can support them, pick them up, take them to their hospital appointment, their doctor's appointment, and they've got somebody there who they can build that trust up, shows them a bit of empathy, and also understands where they're at in their life. It's vital. There's no doubt about it. Half of the people I work with wouldn't have went through their treatment.
Aye. And the vast majority of people in this survey are in rural areas, and that's one thing we're going to do in the summer. We're going to do another piece of work in the cities and to see if there's any differences. So I'm just looking at you, Lindsay. What do you think, especially in rural areas, that is vital?
I think definitely. I mean, support is, well, it's our job, isn't it? Right. So we're there from the testing. We're the common link. Before there was any support, it was somebody would have tested you, somebody else would have called you to say that you've got a positive result. Then you'd be referred to somebody else, and you'd be waiting for that appointment. You'd be referred. Whereas you've got the same face, the same links, the support, and we've got the time. The GPs, the nurses, they don't have the time to sit and listen to anything else that's also going on, because there's other issues, and that's what we're there to do. We can help, we can signpost, we can try and deal with some of these issues along the way of getting the treatment, which is obviously helps it's the full picture. It's a person's journey, isn't it? And it's taking each person that comes in as an individual and saying, right, what can we do while you're doing this treatment, and where can we get you to for the end of it?
Aye. Shug, I know you and John, that's not on your like remit right now. I mean, you did other stuff with addiction service. But when you look back to when you were doing the BBV support, did you feel that was completely vital for some people?
Aye, Billy, 100%. Like Lindsay was saying there, we were involved in a lot of cases for testing right through. And it wasn't just what we tried to do was take the stress off the whole procedure, and that included us making sure we were emailed or phoned appointments, in touch with the in-house suite, if we couldn't get them on the phone, we would go out and make sure they were there, picking them up, getting them through it, prompting, because some people we worked with, just getting a letter through the door wasn't going to cut it.
What about yourself, John?
So the good thing we were doing is making these wee first steps into change, because a lot of people don't like change. The first steps are a wee achievable goal. You know what I mean? We would break it down into small chunks for people that were really, you know, had mental or physical health problems, and try to make it attractive. You know what I mean? This is one thing we can do. We'll come and get you. You know, if you get a letter, phone us and we'll explain what it's going to be, explaining the process for people. So I can see that there's a lot of people that wouldn't have done it if we didn't engage with them to start with and just help them. You know, open a letter, explain stuff. This is part of the treatment. You know, this is the process. This is who you're going to go and see, and we'll be there to help you. Is that all right? And they were, aye, that's all right. So not everybody, but the people that definitely need support, you know, that are hard to reach. People out there, as Eddie said, people with had it for 10 years or longer, and they've just not been able to have the courage to address that stuff. You know what I mean? And Thomas said, I know there's people out there know they've got it and they've just not in the right place. So we try and, you know, we try and explain to them, we can help you achieve that wee goal. It's a first step. I still talk to people like that if they've got it. Going up and I'm talking to a guy the other night. I said, just phone addiction services, and that's one thing you can deal with. I actually put him on to Thomas, actually. So I said, just phone up, and that's one thing. And he's like, all right, I will. So I think it's just the way we talk to people, give them a wee bit of hope.
Is there one thing that you think's essential in a rural area to get people to appointments? I'll start with you, Shug, again.
We have had a few people. We are quite rural down here as well. Transport, definitely. Transport, time appointments weren't always suitable. You know, if it's good taking with different. We're getting it. Some people come for Largs, had to get the train down there, a bus, money for that, getting there on time. Definitely transport make it easier for people in the rural areas, although they're a bit better now, or they were before COVID, about getting, you know, different hubs and things like that. We were always looking into, but back then, definitely.
I totally agree with that, Eddie. And you could add to that? Or?
No, it's transport and support.
Yeah.
That's the two main factors for that.
Yeah. John?
These people couldn't get that. There was that. There was a couple up in, there was a couple that was 50 minutes away from the hospital, and they were getting an appointment at 9 o'clock in the morning. So the fact that we could phone up and say, no, we can get them there, it's a bit later, and we had a bit of understanding with the hospital and explain it, because the nurses ultimately don't want 100% DNAs. They want to be treating people. So it's just the distance, the travel, and the finances. Without a doubt, that's one of the big barriers.
For us, we make it accessible for them. We go to them. So we try and get into all the rural areas for testing and the blood tests. Testing, blood tests, we're trying to build it up so they can do it in the local community. What I'm finding is it's a lack of trust in these wee areas. They're stigmatised in their areas, and their areas are very, very small. So for them to travel out that area with an addiction to go and get treatment is very rare. If we're not going to them, they're not going to be treated in most cases. So we try to approach it a wee bit different. It's go and build up the trust and relationships, make testing available for them, and let them make their own decisions, but giving them that in the local areas, giving them the testing available in the rural communities, and have the nurses for the in-house week going into the areas and setting up wee clinics, individual clinics if need be, fitting what they need in their local areas.
No, I think that's a brilliant point. And Lindsay, I was just going to come to you about relationships and stuff, because a lot of people that you've worked with, it wasn't just about the Hep C, and it was about the actual.
It's having a presence and building up the relationship and the trust, and obviously the more that you can get out into the areas to make it as less a journey, as easy for the person as you can, then that's obviously the bonus.
Right, I'll just leave it there, and I'd like to thank you all for doing this today. I really do appreciate it.
Thank you. That was such a really interesting discussion, and it's highlighting some really kind of good practice out there, where people are putting the person right at the centre of care where they belong. So we're going to move on this time now to our live Q&A. So if I could ask Billy, Lindsay and Eddie to join me on screen for our Q&A panel.
Hi there, I've got some, thanks Lindsay, thanks Eddie. I've got some questions here for you, so you're ready to go. Hopefully we've got enough time to get through them. I've got about 7, I think. Somebody asked, where do you get your referrals from, and do you share data? I'll start with you, Lindsay. Where do you get your referrals from in general?
Well, the referrals can come in really from anywhere. A lot of the referrals come directly from the Annan Hill Suite, so they've known a lot of people for a large number of years. So they've maybe dipped in and out of treatment and not completed it, that kind of thing. They might then direct a referral over to us. We can also have referrals from the addiction nurses or addiction workers, but again, the data sharing's been a big thing for us as we've gone along, just with regards to confidentiality. We get everyone to sign basically we've got a form that they'll sign just to say that they agree for their information to be shared, and that we will share it with the Annan Hill Suite, and the Annan Hill Suite can share it with ourselves, again with their addiction nurses and with their addiction workers. Sometimes they might say that they don't want anything to do with the addiction workers or anything like that, and it would be a direct contract between the BBV unit at the hospital and ourselves. But yeah, we always try and make sure that confidentiality is big, but where risk and things, we need to make sure that we're keeping ourselves safe and that we've got an open communication so that we can share that information.
Okay. Eddie, yourself, where do you mainly get your referrals from? Is it the same as Lindsay?
Much as what Lindsay said, but a lot of our referrals are self-referrals. We find.
Okay. Another one is, I'll go with you, Eddie. What do you think are the biggest barriers to get people still using drugs through treatment?
I think it is information, and stigma, and getting them to appointments. A lot of people feel as if they deserve to be treated because of stigma and the guilt and the shame surrounding hepatitis C, and it's about reassuring them and giving them the right information and building that trust to get them services where they can get help.
Be yourself, Lindsay.
I think, as we spoke in the conversation as well, about keeping it as simple as we can for people. So if we can do it in the community rather than doing a big journey or asking people to for bus fares, that kind of thing. So if we make the treatment, the journey, everything as simple as possible, then that cuts down some of the barriers that are getting faced.
Another question is, do you provide harm reduction advice to people still using illicit drugs, or do you just concentrate on the treatment? Eddie, what about you?
Yeah, definitely. When I'm out working outreach, most of my clients are all using addicts or alcoholics, and I need to give them harm reduction information quite regular, all the time, just to make them aware of the drug trends and which can be on the street, safer injecting, if they need IEPs, we cover that.
Lindsay, I'll go for another one with you. What would make your job easier to get people through treatment, and maybe in regards to services?
Just having open conversation and realising that we're all should be working together for one main goal. I think that would cut down a lot of issues, and if we did all work together, I think it would make a seamless journey, just bridging some of the gaps between the different services and areas.
Have you anything to add to that, Eddie? What would make your job easier, do you think?
I think just more information, people receiving more information about new treatments, but because there's still that preconception of the treatments really hard and getting easy access to it.
There's one question. Do you think for females, do you think the chance of losing their children is a real barrier, which is obviously a myth? I mean, that should never come into play. But do you think for some people that is true? Do they think that? Eddie?
No, anybody I've come up to and spoke to or worked with, no, none of them have thought that.
Have you heard of that, Lindsay, that women are worried about losing their children if they go for treatment and declare their drug use?
I've never had anybody verbalise that, but it's not to say that it's maybe an internal fear that they've got, but certainly nobody's said that out loud to myself.
And it's quite an interesting one. Do you think COVID might help in regards to normalising testing in the future, that more people will come forward for testing because they're used to testing being normal now? Go for you, Lindsay.
Not sure. I think definitely normalising testing is where we want to go with wherever we're speaking to people, and retesting is really important. Obviously reinfection happens, so we want to make testing something that is part of the norm. So I guess if we're testing for everything as we go forward, then yeah, it might.
That'll be yourself, Eddie.
I don't think it's going to be harmful in any way, and it's going to be more positive and try and encourage more people to come in. It's only a benefit and a positive, definitely.
Right. And I think this is the last one, so we're a bit under time. Do you think providing incentives at existing places using rapid tests like mouth swabs at places like GP surgeries, food banks, or even COVID testing centres could help access people not in services who do not know that they have hepatitis C? Go for Lindsay.
Yeah, I mean, I think testing anywhere you can, anywhere that's is obviously going to be a good thing. The incentives that's been offered through SDF and hepatitis as well, when we've done the events, it's really well taken up. So I think to put it out as many places as you can and get the testing as many places as you can, it's obviously going to be again, it's like Eddie said, it's not going to ever be a bad thing to get as many people tested.
That'll be yourself, Eddie.
Yeah, I can only see a positive anywhere, anytime, any place. And if you get them tested, as long as it's a safe environment.
This last question's for me, and it's maybe related to the last one. It's always sort of annoyed me, like how many people out there that don't know they've got hepatitis, and I'm looking at, people that snort cocaine or whatever, or maybe previously used drugs and no longer see themselves part of that, part of society anymore. Have you got any ideas? I've got you, Eddie, about how we actually get people like that tested and get them the information? And it's a hard one because I've not heard the answer yet in 12 years.
You brought up a good point there, because a lot of people used drugs back in the day, 20, 30 years ago, and then they've changed their living habits, and they've ended up growing up in a family with kids, and they've got a normal way of living. And it's about targeting people who could possibly be sick with hepatitis C and they don't know. That's a very difficult question, but I think it's just about making awareness, more information, more flyers, more advertising, and making it okay to be tested. It's nothing bad, it's a positive.
You'd have got a gold star if you'd have got that one. Hey, Lindsay, here's your chance.
I mean, unless they made it sort of like an opt-out testing through GPs when you're getting your bloods or something like that. I don't know the way that pregnant women are tested for HIV as standard, and it's opt-out. I don't know if something like that could be put in place well, that's only within the GP surgeries. I'm not sure at A&E. I don't know. It's difficult.
Aye, I mean, that's something that I've thought before with GPs, but I think with Impact, they're that busy that hepatitis C is down there kind of list of priorities. But we're a bit under, so that's all the questions we've got, Norma. So more time for tea.
Yeah, again, some really good questions and some really good answers and food for thought there. So thank you so much, Eddie, Lindsay and Billy. Really appreciate your input. So we're now going to see two short animated videos that were made for World Hepatitis Day 2020. In the videos, we'll hear some excerpts from interviews of people who've completed the new hepatitis C treatment.
Very easy, very easy. I was surprised.
Easy, very easy.
Yeah, I don't like easy, one of the best things I've done.
It was just a matter of the morning taking my tablets and remembering to take them at night, man. No hassle, no side effects. It was all good, really easy.
Brilliant. I was neither up and down with it. A couple of days I was like kind of lethargic, but no, I wasn't up or down with it.
The first few weeks I had a couple of symptoms, i.e. headache and nausea, but it was explained to me that this would kind of ease up and the symptoms kind of disappeared after 4 weeks.
I found it easy. It was just every day, because I didn't take it with my methadone.
Yeah, I found the treatment really easy. I'm still on my methadone prescription, so I just was picking up my methadone daily at the chemist. So I just actually picked the tablet up daily at the chemist as well.
I was really surprised how easy the treatment was, because I'd heard a couple of wee scare stories about, oh, you end up with sore heads and you're tired all the time. I said it was a breeze for me. I couldn't believe how easy it was. I was sleeping alright, I was eating alright. Alright, it's simple.
I was scared at first when I found out I had to do the treatment, because my friend had done the old treatment. She got really no well in that way, but I was absolutely fine. Didn't really have any side effects of that. The first week I was a bit tired, but apart from that, everything was fine.
Absolutely amazing day. Honestly, after a week or two, I felt absolutely brilliant with the treatment, mate. I can't fault in any way at all.
I felt it was very easy. Very easy. No issues at all.
I felt as if like my energy was coming back, because like before, some days I wouldn't even go, do you know what I mean? Because I felt that crap, but I like gave my energy back.
Before I felt I was always lethargic. Do you know what I mean? I had no energy. I couldn't. My attention span was away. I couldn't focus on anything. I couldn't pay much attention to anything. Then within a few weeks, I started to get more energy, playing football a lot longer.
Physically, I got a lot healthier. As I say, no side effects come through the treatment. I felt a lot healthier physically and mentally. It's that peace of mind that I wasn't going to die with Hep C, you know what I mean? It wasn't a worry on my head all the time.
I'd say my mental health kind of got a bit better, because when I found out I had hepatitis C, I was absolutely devastated. So when I went back to the hospital to get my bloods and that done, I'd finished the treatment and they told me that I'd got the all clear. My mental health so much better.
Yeah, once I got through treatment, I'd more energy. I kind of had more motivation, mentally better, and just the relief.
I did feel more energetic and that, but my mental health got better enough, I'd say.
I was getting a lot of serious when I had the hep, and I've definitely not got there. There's a lot of them away now too. So I have big benefits of getting it done, like, aye, definitely.
I had a lot more energy. All my energy went through the roof. And I felt healthier, and my confidence was a lot better as well, and I felt better about myself. I was more confident in situations.
The people were saying that I looked a lot better.
Physically, it's made me have a bit more energy than I did have before.
I basically felt the health jumping at me, to be honest. But as I say, the health benefits were, to me, amazing. I felt absolutely completely different, and I felt a lot healthier as well.
So, yeah, two cracking animations there. So these videos lead us nicely into the next part of the webinar, Change in Action. And we're going to hear from two people, Scott and Darren, who they're not only going to share their experience of hepatitis C treatment, but also their stories of their drug use, support, recovery, and employment and further education. After this, Scott and Darren are going to be joining Billy and myself for a Q&A afterwards. So again, please submit any questions that you've got into the questions tab. So we're now going to show you the Changes in Action video.
Hi, I'm Billy Hamlin. I work for Hepatitis Scotland, and I'm just going to introduce. You want to introduce yourself?
Hi, I'm Dan Anderson. I'm a recovery support worker in the Vineborough Community, based in the Vineborough Community Centre, in the same community I stay. So
Dan, the reason we're doing this interview is basically a kind of, I suppose, a good news story. I've known you for a few years, and you made a dramatic changes in your life, and it's just, I suppose, it's just to give a bit of hope and hopefully a bit of inspiration to other people that change is possible. So I just ask you about, obviously you've used drugs in the past. How long was that for? Or?
Well, the area I'm from, like, when we were growing up, it was, thinking back now, like, because I know better, there was no positive role models, do you know what I mean? So it was all, like, so we grew up, seen our parents drinking, so we thought, do you know what, we'll just take drugs. And this was in early, do you know what I mean? Maybe, so 11, I started at 11, just hanging with older boys, like, just not negative role models, do you know what I mean? But none of us knew any better then, do you know what I mean?
So obviously during that sort of lifestyle, society, and there's a lot of stigma and discrimination and all that. I mean, do you look back at it different now that you've kind of moved on a bit in your life, or how do you look back now?
I look back now and just think the naivety of it all, do you know what I mean? Like how we just we just didn't know any better, do you know what I mean? Like Sophia 11, like, it was like cannabis, it was just a natural progression, ecstasy at 13. So I'm 39, so really, I don't even know how long that is. Let me think. I'd say 30, so age 13, right? Age 13 was every day. Cannabis, wasn't really much I drink it, to be honest with you, growing up. even older. It's just all drugs, do you know what I mean? So I think the impact of seeing our parents drinking and that, so it's flipped a switch, do you know what I mean? We'll no drink, but we'll take heroin, we'll take crack cocaine, take ecstasy, go to the dance, and everything was just, thinking back, it was a natural progression. Do you know what I mean? It was always chasing the next big buzz, and then by 18, I was an intravenous heroin user.
Aye. So how long at that time were you accessing services, and did you get support for services?
Nah, well, to be honest with you, when I was younger, I was quite content to be an addict. I didn't really want any help. Do you know what I mean? That was just my journey. I think, no, I'm a liar. I think once my mum when I was about 16, my mum realised I was bad with the Valium and take me to services, and they said, oh, it's not a problem. He just uses cannabis and takes on Valium, it's not really a problem. Hindsight, maybe they didn't know. It was all new and blah, blah, blah. But it got worse, you know what I mean?
Aye. So, would you class yourself in recovery? And that means a lot of things to a lot of different people. I don't like narrow it down, but what does that mean for you? And you had positive role models that has encouraged you?
Well, to come off the drugs. Well, I'm on scripts and all that. I didn't work. I could never. Me personally, police prescriptions work, but I couldn't. For me, they didn't work. So I've seen positive role models. Seen some police actually did care and try to help you. Ambulance workers, prison wardens, all school teachers, folk in your community and that. But I never. Like I said, I was quite not content. That was just that was my thing. You know what I mean? That was mine. Do you know what I mean? Then as I got older, I was 26. I'd say sorry, but 26. I started to try and get into recovery. My body, I was in a coma. My body shut down. So it did. I was taking a lot of Valium, and they were reforming my bloodstream. So I'd septicemia. Kidneys failed, my lungs were collapsing, pulmonary embolisms, just one above my heart. Wanted my mum to turn my machine off, and but she didn't do it. Thank God she didn't do it. You know what I mean? Thank God for me, Moz.
I was thinking that you feel like the changes group and that. So was there any positive role models there that you'd seen?
That's what I was going to say. So then I started going to NA. A couple of NA guys got to see me in hospital. I tied in with them. Then as I progressed, but I was still in the madness, you know what I mean? Still had a lot of charges and that. Then skip a couple of years, there was a big recovery movement in North Ayrshire. Like you were involved in it, Changes group, and I done fellowship too, right? That was later on, but I loved the Changes group. Just anarchy. It was ordered anarchy, do you know what I mean? You went there was something beautiful about that anarchy. You could go in and you'd seen folk that maybe you scored drugs for you used when they changed, you know what I mean? Or the ready breakthrough we used to call them, because they all had a go about them, do you know what I mean? And you want it, you don't know how you're going to get it. Something magical about that Changes group that you can just go in and you hear all these stories, and out all the anarchy you get a bit of hope, do you know? But thinking back, it must have been hope. I wasn't aware of it at the time. I didn't go to the Changes group. I didn't go to the Changes group to change. I went for the tea and coffee and the biscuits and the munchies, but something changed in there. Do you know what I mean?
Because obviously I was in a position to give I got people for that group, and then obviously I was in a position to get them eventually into employment. So I think that was a big. Correct me if I'm wrong. I think that was a big thing that actually you could look and say, well, a year ago they were sitting in these seats, and now they're in a job.
Well, that's what I mean. Like, so the folk like the Johnny Aikens and the Shug and Tam who ran the group, do you know what I mean? You started seeing them. At first you're suspicious of them. First I was suspicious because everybody's not so suspicious of somebody doing well, do you know what I mean? But you're watching them like a hawk and you realise that they live up to what they're saying. They're just, folk want the best. For that group, there's probably groups, other areas, for me, that group, and you see the positivity and folk just want the best for you and you start to change, do you know what I mean? You start to realise that you get a wee bit of hope and you start doing good things and good things happen to you.
Yeah, definitely. So, hepatitis, obviously I work for Hepatitis Scotland, and I know you've been through the treatment, and did this Did the treatment have any positive effect on you, not just your liver, but any other areas of your life, you think?
Well, I'm working now, right? So I'm in recovery. It doesn't even matter how long I'm clean. I'm clean a good bit, do you know what I mean? But that doesn't even matter now. In the beginning it mattered to me, but now it doesn't matter. Do you know what I mean? But see, I can honestly hand in my heart say, see, when I went through the treatment, I wouldn't have tried to go to college, wouldn't have tried to get, I would have just went back to a bomb site, and that is good, do you know what I mean? But for me, I wanted to change, wanted to shake everything up. But see, if I never went on the treatment, I'd have still felt more just lethargic. I spoke to you about this, just like dirty, do you know what I mean? I'd have went into, see if I went into a meeting and I hadn't got that treatment, I'd just see you sitting talking to you, I'd have felt less than you for some reason. My mental health would have told me I'm less than you because I've got this, I'm carrying this burden, do you know what I mean? I'm carrying this secret, and after the treatment it was, I think it was instant. Like, even maybe even when I was starting to still take the tablets, it was just like, so like when I said earlier on I was content being an addict.
Yeah.
So just like a flick of the switch, do you know what I mean? And it changed the way, like, normal thinking.
It was a big part for you, and your
big, massive part, definitely. That everything I've done, that was massive for me, massive.
So obviously then you went on to volunteering, and has that had a positive effect in your life? And is that like a gradual process?
Well, I started volunteering with you yourselves, do you know what I mean? So I went to rehab. I couldn't get clean my community. I tried it, I couldn't do it. I went to rehab, but when I come back, I didn't really have much life skills, you know what I mean? Then that's when I started to go back to Changes Group. I don't know if John and that was singing my praises to you or whatever. But I can remember even interviewing and something just the way we were talking, do you know what I mean? I just felt unequal. I didn't feel less than. I didn't go into any pre-misconceptions. It was good, do you know what I mean? And the stuff that came from that.
Aye. So obviously you moved on to be a paid employee, and how does that feel? Somebody paying you for your experience and your skills in your past?
Still mental sometimes, do you know what I mean? Sometimes it's like, what's the word I'm trying to use? It's just like, you need to pinch yourself a wee bit. Do you know what I mean? Because I'm not just, listen, I've not really got a big ego, but I'm not good at my job, do you know what I mean? But I'm only good at my job because I've got the experience in myself. And it doesn't really matter what problems you got, it doesn't matter what drug, it doesn't matter what drink, it's all kind of the same, do you know what I mean? It's the same bone the deck stuff.
Aye. And you've also been accepted for university now as well, which that must be a bit surreal. I've been there.
Well,
I
said, I was in drugs for an early age, you know what I mean? So it's probably clever at school. I didn't apply myself to any at school, do you know what I mean? I was just, everything was a laugh and getting mad with it. Then, but so, I made my job, I started volunteering as a social worker at March, and funding came up for and it's mad. So my job, I work in the same area. I caused a lot of chaos, you know what I mean? I was a drug addict for years, in prison, fighting, terrorising folk, bullying drug dealers, whatever you were in. I would have done anything. There wasn't very much things I wouldn't have done for my addiction, do you know what I mean? So to come back to the exact same area, and folk love seeing how your kids are getting on. Then so answer your original question, so when I went for the interview, I'll go for the interview, right? Because it was on Zoom. I hate Zoom. I hate all these platforms. I like interacting with folk and getting a laugh. But so I went in and she asked about my education and that. I said, listen, I've not really got many things, but she started asking them about work and told her about what we use, how it all started, and my dreams and ambitions, and I got accepted for community development. I hopefully got to do my masters in it. I start September, do you know what I mean? But that's just mad for a boy. Injected drugs, in prison, never went to school, do you know what I mean? Plus I've got my boy full time, my mom, you know what I mean? He suffered a lot from my drug addiction, but building boundaries and building a relationship up with him.
That's going to be my last question, Dan. All these things that we spoke about, how do you think they've both affected you, but probably more importantly, other people around about you?
Affected me massively, right, but it's me or the other folk around. But I was unaware of. I used to think I never really liked my family much. I'm a fair good family, and they love me. But I just thought if I remove myself, I'm not their problem. I'm not giving them worries. So the worries they had, so with family, my brothers and that, the impact's massive. Do you know what I mean? Friends, folk in my community, but more important than that, my son. Do you know what I mean? It's beautiful.
Excellent. That's it. Thanks very much, Dan. I really appreciate it. And good luck for the future. Cheers.
Right, thank you.
Cheers.
My name's Scott McCready. Don't know if to give my second name there, Bill, but right. So my name's Scott. I know I gave voluntary work at the Scottish Drug Forum. I also worked with Turning Point Scotland, and I started with voluntary work with them, and I also did the addiction work college training at South Ayrshire.
Aye. So obviously I've known you for a few years now, Scott, and there's been one of the reasons we're interviewing is there's been obviously massive changes in your life, and it's supposed to give a positive message to people that change is possible, because I've seen it in you. And so just to, as briefly or as long as you want, about your drug use and your past.
Right, so my past, it started halfway. I get brought up kind of all right, although my father was never in my life, right, and my grandparents and stuff like that. I started using just normal cannabis, 13, 14. I was good at football and that, ended up getting a bad injury, so that's when I was already smoking like cannabis and that. Then I started taking like opiates, like there was just tablets like the hydrocodone and Temgesics and stuff, but that kind of quickly, what happened was I started getting in with the wrong crowds. Before I knew it, I was in prison. As soon as the day I turned 16, I was in prison, straight to jail when I was 16. And then from there, that's when I get involved in the bigger drugs like heroin. That's the very first time I taken heroin was in that circle, prison. Do you know what I mean? So maybe if at an early age that I'd have done that straight away instead of punishment, because back there, it was all about punishment back then. Do you know what I mean? Yeah. So that's what I kept doing me, punishment. So I came back out, started for there, and I always ran about with the older people. So I always thought that life was glamorised, taking drugs and selling drugs and all that. So that's what I done. Started selling drugs. Before I knew it, the sentences were getting bigger. So that was like, I spent almost 15 years inside prison, inside the prisons. You know what I mean? Through all the sentences that I'd done. And even in there, I was still continuing with the addictions. Do you know what I mean? Because drugs were so freely to get in prison. So it was just when I was going to prison, it was an inconvenience basically. Do you know what I mean? There was no rehabilitation whatsoever. Do you know what I mean? Maybe if we'd have got a wee bit of rehabilitation, it would have maybe have helped us, but it didn't. So it was just, you were actually learning more about that whole life and that whole circle and cycles that you were involved in than anything else. And through that, it just snowballed to the point was I was addicted, heavily addicted to drugs. I was doing everything. I was injecting drugs. I was doing everything, absolutely every drug. For A to Z, I taken it. So I quickly went by luxury at an early age, onto necessity. Through necessity, I hated myself for the person I'd become, and it was oblivion. I just didn't even want to be existing in this world, saturated in misery, and that's the only way I can describe it. Do you know what I mean?
And as you know that you're moving on in your life, have you got a different perspective at that time?
What? See, just even getting normal clarity around about stuff. Do you know what I mean? Whereas your mind was so deluded with all this stuff, all these BS values that you pick up out there. So for me, I had to come away for that whole life. Right now, I tried it a few times. You know what I mean? It never came to me the very first time. I think it was like 4 or 5 different times I'd actually try to get recovery. I'd get wee periods and I would relapse. But the reason this was happening to me is because I wasn't putting in the work. What I was doing was, I found out quickly when I stopped using drugs that drugs weren't the solution to my problem. Drugs were. That life was a problem for me. I was taking drugs to get away from the life, all these thoughts, feelings and emotions that was inside me that I didn't have any answers for. I didn't know how I was this person. Do you know what I mean? And how I had to actually use drugs. I found out when I was taking these drugs, it was numbing all this stuff inside me. So I didn't have to face the reality of life. Do you know what I mean? So when I put 8 drugs down, the problems were still there. So what I had to do was I had to start then looking at each thing individually, how it was I was feeling this thought, what I was doing as a result of it, and stuff like that. So instead of playing stuff out in real life, I had to just start playing it out in my head and seeing exactly where this was going to lead to. And through doing that, as I say. So putting the drugs down, if I was just doing that and nothing was changing, so I had to start enlarging on stuff. Do you know what I mean? Like going against the grain. So you're selfish as anything when you're in addiction and stuff like that, right? So you've got to become selfless. So you've got to start giving back as well. So I started doing the voluntary stuff. Do you know what I mean? I started enlarging on recovery and getting things like that round about me. Through that, it's just flourished and things have moved on. Do you know what I mean? So definitely a lot of clarity round about stuff fairly doors.
How long were you involved with services?
I was on methadone. I was involved in services for about 16 years old. Right. I was on methadone for about 14 years of that time. Do you know what I mean? And it was just, listen, methadone can help some people, right? I'm not saying it's a good thing. I'm not saying it's a bad thing. But for me, it was just keeping me stuck in that situation. Do you know what I mean? And I didn't know any single person who was using methadone for the way it was being prescribed. Actually, it came off of stuff. What people were doing is using it as a crutch for times when they were waking up, they were rattling, they were strung out. They'll take the methadone first to get them squared up, and then they'll go and they'll get whatever it is they need to get that oblivion effect again. Do you know what I mean? So, but if, I don't know, as I say, so for me, I can only give my opinion on this. I don't think methadone was a good thing for me. Do you know what I mean?
I suppose the other side of it is it's keeping people alive until they get to that stage where they can change their life around, and you know. So
well, with regards to that, I definitely did that, because there was a lot of times where if I'd have woke up in the morning and I didn't have that, I could have maybe went in other directions to the point where getting out and you're doing crazy stuff and end up getting to jail. So it's definitely, it gives you that, as I say, it's got that crutch to it, and it also, there's a stability part to it. And again, just when you're talking about that there, if I wasn't on methadone as well, right, then there would have been times where I'd have probably been in jail even a lot more. Do you know what I mean? Because I'd have done something because I was feeling rough. Do you know what I mean? So that taking that away.
Can I just ask you, like, you're in recovery now, whatever that means, it means different things to different people. You know, what does that mean for you in your life right now?
My recovery means for me, right, I've got a wee son. My wee son lost his mum to drug addiction when he was 1. So recovery, and for me, is being there, not just physically, but emotionally for my kid. Being a responsible member of society, and being a son, being a brother. Do you know what I mean? Being an auntie, being an uncle. Do you know what I mean? And just being a good person. Do you know what I mean? Because all that comes second nature to the actual addiction. You know what I mean? So you're caught up in this addiction. It's all you live for. Everything comes second nature to it. You can love your kids, you can love your family, but they'll always come second to this. And as soon as you do that, then that's what do you know what I mean? As soon as you start looking at addressing it, then you can start rebuilding your life.
Can I ask you, I know you've been through, just particularly because I work for Hepatitis Scotland, you've been through both the old treatment and the new treatment. Could you discuss the differences and any benefits that's had to your life?
Right, well, with regards to old treatment, I'd done the old treatment. The old treatment came about and nobody even knew exactly where it was. Right, I was in prison, and I think we were just, I don't know, to be fair, what they were actually doing with it. But we were in prison, and there was 6 or 7 of us that done it all at the same time that I knew about. And I think there's probably more than that. But out of the 6, for me personally, I take all this stuff. So you're taking a load of tablets every day. So you're taking like 30 tablets every day. You're taking an injection once a week, right? I felt as if the only way I can describe it is I thought I had a hole in my head, constant hole in my head. So it didn't just affect my physical health. My physical health was deteriorating quickly with it, and my mental health was deteriorating even faster. Do you know what I mean? It was a horrible, horrible thing, and everybody else that went on it as well. It wasn't good for them.
What about the new treatment?
And then again, I was also in prison when I got the new treatment, and I'd obviously, because I'd been through the old one, I was a wee bit sceptical of the new treatment. But there was a few people that had already started it. They said they were absolutely fine. It was totally different. So I went down. I actually spoke to the nurse that was gave me an appointment and that. She explained it to me. It was 1 tablet a day. I was only 1 tablet I was only having to take, and do you know what I mean? For 8 to 12 weeks. I think mine was only 9 weeks I had to take it for. There was absolutely no side effects whatsoever. I slept like a baby during it. Do you know what I mean? And I could feel myself getting better as well. And this was hepatitis was something that it was always there, right? But I never ever thought too much about it because I was running on everything else with the drugs and stuff like that. And it was only ever when I got a wee bit clean that I was starting to think about stuff like that.
And do you think that has helped you in your, not just obviously your liver, do you think it's helped you in your general life?
Definitely, general life. Now, as I say, I think this is only really a realisation round about this, right? When I look back on it now, for instance, I never ever thought much about it, right? I've done the first when I got diagnosed with it, I've done that, right? You lived for about 20 years because back then, and when we get diagnosed with it, there was nothing about and stuff like that. So, like, you know what I mean? And it was just fortunate that I didn't really drink too much, so my liver wasn't too bad, but obviously it was still worse than a normal person's. But then, with regards coming that when I was on it, right, when I had it, sorry, got to get into relationships. So you're being deceitful for the start, right? Because you don't know how to open up and talk about stuff like that, especially when nobody knows nothing about it, and they instantly identify it with things like HIV and stuff like that. That's what they think. So straight away, you've got that barrier for getting into a new relationship. And then, so when my wee boy's mum, when she was pregnant, I've done that. That opened a big full can of worms for me. I've done that. I've never even told her I had this. What happens if my sons got it? This and that. Do you know what I mean? So it's definitely just having it means. Do you know what I mean? If you're going into a new relationship with somebody, it's a big thing lifted off your shoulders. It's definitely a big weight lifted off your shoulders. Not having it. Do you know what I mean? It gives you peace of mind as well that you can go and live a normal, healthy life. Do you know what I mean?
Regards to like volunteering, I know you went to college as well. How much a boost was that for you, and how much affected that has that had in your?
It's definitely been a big fit. As I say, it started off right, having to go against the grain because it was always about me, always about what I could get and all that sort of stuff. So straight away, you're going against it, and it's not about what you can get, it's about what you can give. So it's like using my experience, do you know what I mean, to help others. You know what I mean? Hopefully benefit them, give them a bit of hope that, do you know what, this is available for you as well, not just for me. You're no different to me. This could help you as well. So, and for a personal level, for me, it's gave me the more confidence. Do you know what I mean? Because I was so shut off, it was unreal. I was sitting in my house constantly, drug psychosis. Do you know what I mean? For all the crack cocaine and all that I was smoking. So just having the confidence, people skills, communication skills, do you know what I mean? And just keep doing stuff like that. So that's what that's done for me. And then obviously, so that's what the volunteering part's done for me. And then obviously the college, enlarging, I didn't know how brainy I was. Do you know what I mean? I lived with these limited beliefs for so many years. So now I go like that. I don't know how brainy I am. And it's only through challenging myself with doing these kind of things that I now realise, do you know what? You're actually all right, and you know what I mean, you can do this stuff. Do you know what I mean? So it's definitely good.
And recently you've just managed to get paid employment as well. So how did that make you feel?
Do you know something? That was somebody else that was in recovery that's wanting to do the same kind of stuff, John, and that's what he said to you. He says, this is a big deal, mate. He says, this is your very first paid job. Do you know what I mean? See, when I actually sat back and I looked at it, do you know what I mean? You get a sense of pride, do you know what I mean? And the way I explained it was, I'm used to making hundreds of money selling drugs, right? But I didn't have any peace of mind with it. I was on edge 24/7. I'd sleep with blades under my pillow at night, my door barricaded because I didn't know when my freedom was going to get taken away from me. Do you know what I mean? I was on my tiptoes constantly, didn't know when enemies are going to try and come for you, all that sort of stuff. So making all that kind of money, that's what's attached to it. So you're not making anywhere near that, but do you know what? It's fulfilling. It gives you that peace of mind in your head, and it's good. Do you know what I mean? And it also shows me that if you actually do you know what I mean, give back and stuff like that, it gets noticed and you get rewarded. Do you know what I mean, for actually helping and doing stuff? Do you know what I mean?
Yeah. And just my last question: how's all these things that we spoke about? How's that affected not just you, but the people around about you, and how they see you and how you see yourself?
Well, my wee ma, for instance, right, she just recently had got diagnosed with cancer, so she had to go through our treatments and that, right? Now, early doors when my wee boy stayed there constantly because of the way I was, right? And so she was always on edge with me in and out of prison and all that, right? So the fact that I'm now in a good position. Do you know what I mean? So when she had to get into hospital and all that there for like a month and a half, my wee boy's with me constantly throughout that. So it gives her no worries. And then obviously with my son, I was always there in the moment. I wasn't there in the moment, sorry. I was always there, and I was looking at my watch, huffing and puffing through whatever I had to do with him, because I always had something in my head where I had to be or whatever. So just keeping it in the moment with him, being there, enjoying the time, and being there emotionally for him. And as a result, I see him. Do you know what I mean? I see it benefiting him. Do you know what I mean? He's actually coming out his shell and being the son now. Do you know what I mean? Whereas he was a wee bit shut off. So I see it in him as well now. Do you know what I mean? And just being a good role model for them.
Brilliant. That's it. Thanks very much, Scott. Appreciate it. Really do.
Well,
and good luck. Good luck in the future, man.
Hey, well, thanks.
Cheers, pal.
See you later, Bill.
Thank you so much, Scott and Dan. Honestly, I really appreciate how candid you are. And both of you spoke about role modelling, and I think that, you know, you're amazing role models and really inspiring. So I would now like to invite Billy, Scott and Dan to join me on the screen for that question and answer session, if that's okay.
See, before I start, there's a couple of questions I missed about the previous one about Hep C, so I asked Eddie and Lindsay to reply, so I'll just throw them in. Somebody had asked about if they, and Eddie said he had a few, and Lindsay says there's been some, but she's not had any personally. And somebody asked about targeting the parents of current drug users, and Eddie thought that would be difficult to approach, but Lindsay thought that might be a good idea. And also somebody just said a statement that, what about the Scottish Government releasing a TV campaign explaining Hep C and how your behaviours 20, 30 years ago could have a big effect on your life now. So, sorry, I'd missed them, so just to kind of get them in. Hey, thanks, Dan and Scott. I know there's a wee few technical issues today, so...
you could say that.
So, I'll start off. I'll start off with you, Dan. What was... I've got about 9 questions here for you. So, what was the biggest trigger in regards to changing your life around, or your recovery, or whatever you want to put it? I'll put it to you first, Dan.
What was my defining moment getting into recovery?
A big motivation to go, you know what, I'm doing this. So.
I was at a funeral, been to hundreds of funerals, and just never really, well, just a funeral, wasn't it? You end up getting used to them. And one of my best pals, we were getting in about recovery a wee bit. Maybe we were trying a wee bit before then, do you know what I mean? Just trying, and we might go fishing that day, but he wasn't there. And you see that way you get something in your gut. But anyway, long story short, he died. So he died in his house, his cell. So I was kind of half and half. Then I went to his funeral, and I seen his wee girl crying, and something just, I've probably seen it 100 times before. Do you know what I mean? But something just in that precise moment in time. A week later, I was away to rehab.
What about yourself, Scott? Was there a defining moment for you that you thought, right, this is the time?
You know what, they always talk about hitting rock bottoms and all that, right? Now, I must have hit about 10 rock bottoms, and then it was just the last time I was in prison. Do you know what I mean? I've just done that myself, and it wasn't for me. Everybody's walking about spiced out their head, right? Everybody that's in prison now, it's all changed as well, so younger. So I'm not a dinosaur here. Do you know what I mean? And I realised that they were only getting bigger, the prison sentences. Do you know what I mean? My addictions were just getting worse. Everybody was dying round about us. Everybody for the schemes, do you know what I mean? They were all dying, folk that I grew up with. And I knew the age I was getting to, it was going to be much longer before I was either doing a very large prison sentence, right, or I'd have been dead as well. And then I think, just to make that even clearer for us, was my ma. Do you know what I mean? She was getting older, she had my wee boy and all that constantly. Do you know what I mean? So just wanting to become responsible in that again. Do you know what I mean?
What were the major barriers, do you think, to actually being successful in recovery, if there was any?
For me, the barriers, right, was accessing treatment, right? With regards to accessing treatment now, there's all different ones, you know what I mean? Like, for instance, I remember I came off everything, methadone and all that, right? Got a wee bit of recovery, relapsed, so I was back banging about everything, and I've done that myself. I need help, but I knew it was coming. Do you know what I mean? I reached out saying I need back on the script and that, and this did happen. Do you know what I mean? Next thing, social workers, you know what I mean? It would just so happened it was by luck. It taken social work 8 months to filter through social work that I was back using drugs. So by the time they actually came out to check, I was back all right again. Do you know what I mean? So just that's one big barrier for me. Another time was I was out on licence. I knew every chance I got it recalled back to jail, so I just continued trying to do my own thing, and it just snowballed through there. So that was 2 big barriers for me.
What about you, Dan? Is there anything you think?
I would say two main barriers. For me, the first barrier that I would say myself with my own barrier. All right, there's maybe not the best of service, but I've always thought there was enough services there. If you're willing to use your voice to fin it, if you wanted it hard enough, you would get it. There is things out there. Some of the different programmes, Christians, secular, third sector, statutory. There is stuff there. Do you know what I mean? But you either don't know about it, or if you do know about it, you're not using your voice to find it. Do you know what I mean? You're not articulating what you actually want in life.
Mm-hmm.
Do you know what I mean? And going out and getting it. The second one was being on methadone. I think methadone does work, it does work, but for me, I can only speak for me, it didn't work for me. I just used it as a top up. So it's just got a doctor, and you think that's recovery. I remember going on my meth and thinking, to tell my family I'm doing great and all that, I'm on my meth, and well, the way we're looking at it, the now, do you know what I mean? Like, you're pure delusional. There's no way that will continue, that will not. So once you're on the meth, coming off it was for me. I just done it cold turkey, but I think that my biggest barrier in recovery was myself, finding my own voice to see what I want, articulate your emotions. So emotions was my main barrier.
Mm-hmm. Both of you had said in the interview about Hep C treatment. Why was it so important for you, Dan? Because you said it was really important for you.
For me, I would say probably the most important thing that I've done in recovery. In fact, not even recovery. Like, I could see if I'd still cleaning now, right? So I could be working and blah blah blah. If I never had that Hep treatment, I'd still, my head would still be weight. I'd still be a cloud above my head. I wouldn't believe in myself. I'd still feel dirty. I'd go into houses, and if they were talking about putting the washing out or something in the kitchen, I would feel they were talking about me having Hep. Do you know what I mean? I would everything, because I would have that much of a cloud on me, I would always feel less than. So whenever I come off treatment, I've got a lot. I'm not saying it in pride, but I've got a lot in my life now. That my son, a good job, family, a fiance and that. But see, if I never would come off on the treatment, I can honestly say I don't think I would have any of that. I'd still be using. I would use that excuse of feeling dirty to try and find a bit of comfort. It wouldn't work, but I would try and tell myself and try to reach for a bit of comfort.
That's quite a powerful statement. I mean, how do you feel about that, Scott?
With regards the treatment and stuff like that, I didn't actually think too much into it, right, when I was actually out there performing, right, because let's face it, do you know what I mean, it's the last thing on your mind, you know what I mean? It's only actually for me when I started doing all right for myself. But with regards getting on the treatment, right, it came by chance for me, right, because I did try to get, obviously I went through the old treatment, right, and I accessed that in prison. That was by chance again, right, and the new treatment was also by chance. But see, before I accessed the new treatment in prison, I tried to get it out here, right, through drug service. They says I couldn't get it because I was taking all these drugs, right, so that was one big thing straight away. So then it was only when I was in prison I was actually managed to access it again, right, and it was, I was obviously sceptical about it, you know what I mean, because of the old treatment, but I'd heard a few stories of folk that had been through it, you know what I mean, that there was no side effects and all that, and that's what happened for me. So actually, with regards after it, it was only when I realised, see, when I was in relationships and stuff, right, and I had hepatitis, and this is probably through stigma and uneducated, right, folk, you can't just turn around and go like, somebody you're in a relationship with, but you have your hepatitis, do you know what I mean? So it's a big weight that you've got. So obviously when you get away from all that, that's a big weight. It's lifted. Do you know what I mean? And the reason probably So that's you straight away. You're in a relationship, you're being dishonest because you're not telling them about it, right? And then my wee boy, the last year I was very pregnant with Wayne, and I'm like, shit. So that was another big can of worms that had to be opened. You know what I mean? And it's probably just through, as I say, lack of education and stigma. So folk instantly think hepatitis, HIV, things like that. Do you know what I mean? They don't actually know. And then especially now, with the treatments available, you can take it 1 tablet a day, 8 weeks, it's gone, and that's you. You've cleared it. Do you know what I mean? So that's the things for me, definitely.
There's a couple of questions for somebody you know. It's John.
Sit pennies.
What has surprised you about your recovery?
Which surprised me about my recovery, right, is there's so many different types of recovery, right? Now, I tried one separate way of recovery for so long, right? It works for some people. It built so much pressure for me, right, to live this thing with. So it was only through other means of recovery, right, that I managed to. But where it was for me was the limited beliefs that I lived with myself, right? So I started to challenge myself. Do you know what I mean? So the thing that's probably hindered me most about recovery is I don't actually know how intelligent I really am with things. Do you know what I mean? So it's keep challenging myself. Do you know what I mean? And keep going. So if coming out my comfort zone, whereas I would just use drugs. Do you know what I mean? Anytime I came across something that was uncomfortable, I'd use a drug to get out of that. Do you know what I mean? Whereas now it's just keep growing and stuff like that, and it's good.
How about you, Dan? Has anything surprised you about recovery or your recovery?
I could keep it simple, right? But what surprised me about recovery, see the way I felt, what I used to use on, everybody feels it. See, everybody who you deemed it has made it, and I was nothing special, do you know what I mean? My feelings were, oh, nobody gets me, blah, 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 but everybody had their feelings, so I had no responsibility. I wasn't. Now I've got my son and all that, so I'm responsible for him. I can't act on my emotions. Do you know what I mean? That's a surprise. I don't know. I wouldn't always surprised the life I've got, and I have got a good life. Do you know what I mean? I've got a fiance, my son, and that, but I'm not, because everybody's got things like that. I'm just surprised with the way I feel. Everybody feels it, and it's just one. It's how you can learn to cope with that and learn that you're no labelled. Do you know what I mean? You could go to a doctor and you believe you've got all these things and you run on it. I would the full alphabet flung at me, do you know what I mean? So I would have ran on that, but recovery, I'm surprised. I'm not that special, and I just deal with stuff the way everybody else deals with. So just that, aye.
This is one for you, Dan. How did you find rehab different compared to remaining in the community? Because I know you mentioned you were in rehab.
I couldn't. In fact, it's weird John's sitting in here, right? So I was one of the ones, I don't know, I'm quite tough on myself. I used to see folk go to meet different forms of recovery, right? And then you would see them getting it. So I would try that, and I would never get it. And so I used to wait till I do step 2 and all that, and I'll be me, I'll be clean. Not even knowing how you do it. Just thinking you could pick up a book or whatever. So you see them folk doing it in the community and that. So I still stay in the community where I caused a lot of damage. Grew up, all my pals are in about the madness, do you know what I mean? Well, a lot of us, about 50, just my age, growing up, there's lucky there's 5 years left. It's all drugs. It's all drugs have died. Just my age, I'm not talking about the Scots age or young or even younger, so it's added on. So I couldn't do it. I can remember I went to rehab once. I went to rehab for 4 months. I come back out and I was like, I want to do it in the community and all that, but I couldn't. So me going to rehab, it was a lot different for me. I had to work on myself. See, if I was out in the community, I would have had an image to project. I have an image I'm an addict. You'll just leave me alone. I don't want to know any use. I'm a wee thief and I'm a liar. I'm a cheater. I had the image when I was just in the jail or just out and where I'm hinting my wee ticket and I'm growling and I'm fighting. Then I've got the images to my family where I'm a wee victim. So if I've got all these images in the community, like, who am I? I don't really know who am I. In my community, I asked 10 folk my opinion of me a couple of years ago, and my wee gran or somebody in the street or somebody stole something, there would be 10 different opinions of who I was. So go to a rehab, I found out who I actually was. I go to work in my heart, work in my belief system, So rehab, I couldn't date in the community. So 40 date in the community, hats off to you, do you know what I mean? And it worked for me, go to rehab, do you know what I mean? So it's just different forms, isn't it? But in the community a couple of years ago, I was 10 different. I didn't even know who I was. So
it just emphasises it's different for different people. You know, and one for you, Scott. So you started taking heroin in prison. Was that the norm at that time in prison?
Do you know something? See, when I started taking it, was actually, I think I'm going local. I was only 16, just turning 17 actually, right? I was a boy for Dundee. Now, I didn't really know much about heroin at that point, because see, in my area, nobody actually sold it, right? So, but see, when I was away for near enough 2 years that time, right? So, back in so just over 16, I came out, I was like 18 and a bit, right? And the place was flooded with it. Do you know what I mean? So it was for me, it was lack of education. Do you know what I mean? I didn't know what this drug did to you when I started taking it. And then it was too late to the point where I was addicted to it. Do you know what I mean? Whereas I think the difference nowadays with our kids is they see what that stuff does to you. Do you know what I mean? And so it's like it's becoming like my age that's so addicted to it. Do you know what I mean? And that's how you see the stats today. It's all older ones that's dying it as well.
Right. The last question. What are your hopes and ambitions for the future, and what would you say to others who were basically in the same position as you 4 or 5 years ago when I first met?
So my hopes and things for the future is just to actually build a good career, right? Be a productive member of society, do you know what I mean? And being my best self, do you know what I mean? And just being there for my son emotionally as well as in the moment. There was so many times I'd go like that in the tub and I'd be looking at the clock, like thinking where I had to be. Do you know what I mean? Or I'd be regret my past, or I'd be have anxiety about the future. Do you know what I mean? I could never just keep it here in the moment. So I think that's what it is for me. Just keep it in the moment and try and do my best 24 hours and always just, as I say, giving back as well. That's what it is for me. Do you know what I mean? There was people there for me. Do you know what I mean? So I think that's what it's all about. Do you know what I mean? Inspire, change, and gain folk hope.
What would you say to people who were there, 4 or 5 years ago when you were, when I first met you, or whatever? If they were going down this route?
What would I say to somebody if they were going to go down this route? If I was, recovery?
Right.
Well, is keep be open-minded with your recovery. Do you know what I mean? Not one shoe fits all. Everybody's different. Do you know what I mean? And just start, man.
So Dan, what's your hopes and ambitions about what you tell? What would you say to somebody else who was maybe trying to get into recovery right now?
I just want the world. I don't want much.
No.
I don't. My hopes, but for the future, my hopes professionally, or farm personally. Professionally, I want mine things for a day. Mine third sector organisation. But it's just it works for me. I'm quite streetish. Do you know what I mean? I'm clever in that, but I like raw recovery. I like being out in the trenches. Don't like bogged down. I hate computers. So do you know what I mean?
Never, I guess.
I hate plans. I hate all that because it's bad for me. Do you know what I mean? So I may as well focus on what I'm good at. So for me, I think it's called helping hands, and it's broad. Do you know what I mean? There's no barricades or anything to get in. Just something it's quite hang me. I'm already started it. So for that, main place with a gym in that, and it's that fitness is important. I think fitness is important in recovery for mental health, and so I'm always promoting that. And everything else, it's just like a progression in it. So I've got my son. Probably future, I hope he would listen to me. Do you know what I mean? That's a work in progress. But I said I'm happy with the way I'm mother now. So I've got plans in that. Do you know what I mean? But and they always come. I make like a year plan, 2-year plan, 5-year plan, and I try to stick to it.
What would you say to somebody that's coming into recovery now or trying to come into recovery? See,
to be honest with you, I couldn't really answer that. I couldn't, because it's quite recovery, isn't it? It's not like what works for me won't work for them. What works for Scott won't work for me. Do you know what I mean? My recovery isn't his recovery. So all I would do is just be there for them. Do you know what I mean? Get round about them. Ask first if they say they want to change, I always ask them what is it in an ideal world, what would they want? Then I would work off that. realistically, small time goals, different approaches to see what works. So I couldn't give you a general what I would say to them, because I could say something that's lies. Do you know what I mean? And that's going to cause a lot more harm than actually good. So it would just be what the person was at in their life, what they wanted, because there's a lot of it's. Do you know what I mean? It's a lot of it's quite too broad to give a specific answer for me.
I'd just like to thank the bases, really do. Thanks very much to you for sharing all this information. It's been brilliant for me. Thanks very much.
Yeah,
thank you.
Yeah, thank you again so much. Really appreciate it. Your input's been absolutely invaluable to this conference, and can't thank you enough.
We'll switch off.
It's been a pleasure.
So yeah, so that's the end of day one of this is a mouthful, the Hepatitis Scotland online conference, living experience, patients and peer perspectives. But I've certainly thoroughly enjoyed it, and I hope you have too. Thank you so much. See you later. See you tomorrow. Bye.